Good afternoon. My name is Bruce Rosen, and I'm the director of MJB's Smoker Center for Health Policy Research. Today, I'll be sharing with you preliminary findings from my ongoing study of a vital but little-known aspect of Israeli healthcare: its impressive ability to identify relevant innovations developed in other countries and then adapt them to Israel. I'll be sharing with you 5 general lessons I've learned from 20 stories of successful adaptations that I've gathered to date from a broad range of Israeli healthcare leaders. But first, let me tell you about an illustrative example of a successful adaptation that I heard from Professor Avi Porat, the chief physician of Maccabi Healthcare, someone who is widely recognized as one of Israel's leaders in healthcare innovation. This past February, Avi and I were on a long bus ride together from Jerusalem to the annual Health System Leadership Conference near the Dead Sea. I asked Avi for an example of how Israel adapts innovations from abroad, an example in which he was personally involved. Avi began by noting that Israel is currently at the cutting edge internationally in the use of telecommunications and video to provide care at a distance to seriously ill patients while in their own homes. Avi also indicated that he had played a major role in encouraging Maccabi to invest in this area. What turned Avi on to the possibilities involved in this emerging technology was his participation over a decade ago in a conference in California in which he heard about the effective use of telemedicine in prison health. And I'll repeat that because it's a key part of the story: prison health. Until then, Avi said, he had thought of telecommunication and telemedicine as a technology of value only in large, sparsely populated places like Wyoming or Siberia, where there was a need to overcome really big distances. Hence, he had previously felt that while this was an interesting technology, it was not so relevant to small countries like Israel. However, after hearing that talk in California about prison health, Avi realized that telecommunications could be used to address a wide range of barriers to having patients and the physicians in the same room, and not just those related to large distances. So then, he began to think about whether telemedicine could help bridge the gap in Israel between clinicians based in Maccabi offices and the mobility-limited, seriously ill patients based in their own homes. And in the years that followed, Avi, along with others at Maccabi, planned and implemented their pioneering effort. Over the past 6 months, I've been having a fascinating time collecting stories like this one from healthcare leaders in Israel, from government policymakers, health plan and hospital CEOs, planning directors, independent pundits, and others. I've been asking them to share with me the stories of innovations that they helped import to Israel. I want to know from them how they came across that innovation, what adaptations they made to make the original innovation a better fit for Israel, and why they made those adaptations. So far, I've collected 20 such stories, and I'd like to share with you 5 of the emerging themes. First, almost every Israeli healthcare leader has a story like Avi's, and they are very excited to tell that story. Second, several of these stories touch upon some of the most important changes in Israeli healthcare over the past 20 years: quality monitoring, capitation formula, tobacco control, and much more. Third, in some cases, the innovation was identified as the result of a deliberate search for potential solutions to a very specific problem. But often, the innovation was discovered by the way, as part of a more general interaction between Israelis and non-Israelis. A conversation is held over coffee with a colleague from abroad who has come to Israel. Someone from Israel participates in an international conference abroad, or reads a journal article, or watches a TV show. there seem to be many different ways that we can discover relevant information about innovations from abroad if we are open to them. Fourth, generally we don't simply perform a copy-paste on the innovation found elsewhere. We make adaptations. Sometimes these adaptations are undertaken because of limitations in our own system, such as insufficient funds or shortage of professionals. But at other times, they're undertaken because of particular strengths of our own system, such as advanced electronic health records or the organizational capacity of our health plans. And here's something I found particularly interesting. Quite often, what has been critical is the combination of the two. An Israeli limitation forcing the search for an adaptation, and Israeli strength providing the key to the solution. Fifth, several personality characteristics appear to play a role in facilitating the transfer and adaptation of innovations from other countries. A mix of humility and chutzpah, the sense that I need to learn from others, but I can also take what I learn and tweak it for the better. Associative thinking, seeing how an innovation that addresses one problem might address another problem. To realize that technology that works for prisoners might also work for mobility-limited, seriously ill patients. And courage, because the adaptations don't always work, and one needs to be willing to take the risk of failing. And sometimes even being accused of not paying sufficient attention to Israel's unique characteristics. And so, I'm continuing to collect stories like the one I heard from Avi, like the 20 I've collected thus far. If you have a story of this sort, please reach out to me and share it. Each and every story carries with it the potential for a mini revolution in Israeli healthcare. Thank you.